everybody. My name is Dr. Douglas Street, and today we'll be talking about a very common condition which we refer to as acid reflux. Now, the correct medical term for acid reflux is actually gastroesophageal reflux disease. And the traditional teaching is that it is caused when the acidic contents of the stomach flow back up the esophagus, which is the tube that carries the food down from the mouth to the stomach, and causes irritation and sometimes damage to it. As I mentioned before, it's actually quite common and it occurs in all ages, even in children. And it's a long-term condition and it's traditionally thought to be incurable. The traditional teaching is that it is caused because of a weakness in the muscles that control the entrance of the stomach, which is usually the diaphragm, which is the muscle that separates the lungs from the abdomen. And sometimes they actually have situations where there's so much weakness that even parts of the stomach might actually be going through that defect, that loose area. And there are, of course, a number of different conditions that can increase the risk of it, such as pregnancy. Now, the symptoms of GERD usually occur more at nights, and that is usually because of the posture that we assume, which is lying down. And these symptoms include heartburn, also a backflow of the stomach contents into the mouth, and you may also have difficulty or pain and swallowing, you may have nausea, and you may have excessive production of saliva. Some persons may have a cough, sore throat, and hoarseness. Of course, this condition is often associated with complications, and these include inflammation and even also formation of the esophagus, and a pre-cancerous condition we call Barrett's esophagus, where there's a changing of the lining of the esophagus. Cancer can actually occur from this condition, and you may also have flare-up of asthma. The diagnosis of acid reflux is usually made by a doctor, of course, and they usually put them on medications as a result of that. Now, there are some lifestyle changes that may increase the risk of acid reflux, and these include obesity, tight-fitting clothes, eating 2 or 3 hours with less than 2 or 3 hours before bedtime. This can increase risk, so of course, avoiding these things can, especially if they are large meals. Alcohol can actually increase the risk of acid reflux as well, and smoking. There are some foods that may cause aggravation of the symptoms of acid reflux, and these include acidic foods and drinks, such as sodas, citrus fruits and drinks, carbonated beverages, cruciferous vegetables such as cauliflower, broccoli, cabbage, Brussels sprouts. Dairy products can also aggravate the symptoms, fatty foods, spicy foods, peppermint, and tomato. What has been found of late is that there is more to this condition than it was traditionally thought. And we're going to be touching on what research is now showing that is a main contributor to acid reflux. One of the things that has been found is that there is oftentimes not a good correlation between the symptoms of acid reflux and the investigations that are done. And one of the main ones that is done is the barium meal. And oftentimes there are symptoms of acid reflux, and when you do the x-rays, in less than 50% of persons with symptoms of acid reflux actually are shown to have the condition on the x-ray. This, of course, is kind of puzzling because you expect to be finding the phenomenon occurring in these patients, and it is not, because the symptoms are classical. What they have been finding of late is that inflammation of the wall of the esophagus and stomach has been strongly associated with the symptoms of acid reflux, and in fact more so than the x-ray findings. And they have found that when this inflammation is controlled, the symptoms settle down better. So the thinking is that that acid reflux, what we call acid reflux, is actually caused by inflammation, not so much the acid. And it makes sense because, of course, the acid is supposed to be there in the stomach, so why would it be causing a problem? The traditional treatments for acid reflux is using medication that reduce the acidity in the stomach, but these can cause several complications. As we had mentioned before, it can cause osteoporosis, which is weakness in the bones. It has been found also to increase risk of gastroenteritis, and this is because of the reduction in acid. This increases the amount of bacteria that can get through the stomach, and some of these bacteria can be harmful. It also reduces the absorption of calcium, and therefore the bones can get weak. It has also been found to increase the risk of heart disease and even kidney failure. And the thinking behind that is that the medication that reduces the acid in the stomach also reduces the cell's ability to remove their waste matter, and therefore it increases the risk of other conditions. So by treating the inflammation in the stomach, that might actually be a better way of treating the acid reflux. Now, milk can soothe the symptoms, but the problem is that the proteins in milk increase inflammation inside the body, and this inflammation can go on to increase the inflammation in the wall of the stomach. Also, some person may find that there's an association with allergic rhinitis and sinusitis with acid reflux, and the reason for that is that the reaction produces inflammation in the body, and that inflammation can also affect the stomach wall. So what we probably should be thinking about in the medium to long term in the treatment of acid reflux is reducing the inflammation inside the body using various measures. And this has been found to be very useful. So reducing the acid in the stomach should be used as a temporary intervention rather than long term. The focus should be on reducing the inflammation and the factors that contribute to inflammation. One of the things that has been found to cause this inflammation is an imbalance of the bacteria in the intestines, and therefore measures that improve the balance of the bacteria in the intestines, such as using probiotics, have been found to improve the symptoms of acid reflux. So in summary, acid reflux is a very common condition, and it seems to be more associated with inflammation in the wall of the esophagus and the stomach, and measures that safely reduce the inflammation in these areas have been found to be very effective in controlling the condition. Thank you very much for listening.